Hello, welcome back to Nurse Margaret Community, and in this video we are going to continue talking about the ethical dilemmas that we face as nurses every day at work, or most of the time at work. So welcome back, nurses and nursing students, to this channel. Today we have a question we're going to ask ourselves, and the question is, would you resuscitate a DNR patient? Would you resuscitate a DNR patient? So that's our question today. Now, let's take a case scenario. You're working in a medical surgical unit, and you have a 78-year-old female who suddenly goes into a cardiac arrest. You have checked the most form in the chart. The most form in the chart is valid. It clearly states DNR. Do not resuscitate. The family is there. The family wants you to do everything. The family wants you to start CPR. What would you do?
This is where nursing ethics collide. Because you, as a nurse, you're looking at your patient, the patient is pulseless. The chart or the most form tells you, do not resuscitate. The family is here. The situation is chaotic. It's emotional. It's loud. You are caught in the middle of this situation. The family looks at you and thinks that you don't really care about their loved one. Because no matter how much you try to tell them, the wishes of the patient is DNR, the family thinks that doing CPR is part of care. You're caught in the middle. Ethical dilemmas, autonomy. The family, the patient had already made her wishes. Beneficence. The family thinks, doing CPR is part of care. What would you do as a nurse? The nursing truth here is, a DNR is a legal document. It's a legal order written by a physician. It's not a suggestion. It's not an assumption. So nurses must honor the patient's wishes, which is autonomy. But let's be real. Put yourself in this situation. You're looking at this patient, the family, it's so helpless. They're looking at you. They want to help. They want CPR. This is your patient. You're vulnerable. You don't know what to do. You don't want to lose your patient as well. But your hands are tied because the patient had made her wishes. There is a valid DNR in the chart. The most form clearly states DNR. So you cannot perform CPR on a DNR patient. Honoring DNR always the right thing, even when the family is devastated. So thank you, and follow me for more nursing ethical dilemmas.